Friends, welcome to my workplace at Ranaghat, West Bengal, India. In this video, we are going to see management of a hard cataract under topical anesthesia. This is the main incision with a 2.8 millimeter steel keratome. Now, a side port is made on the right side of the main incision by the keratome itself. And now an air bubble is injected into the anterior chamber. Trypan blue dye is then applied over the anterior capsule. And now this is phenocane from Entode. Phenocane contains tropicamide, phenylephrine and lignocaine. And then this is a bit of adrenaline also. The antechamber is washed, and then 2% hydroxypropyl methyl cellulose is used to fill off the anterior chamber. The patient is moving her eye a lot, but she is trying to cooperate. This is a side port on the left side of the main incision. Whenever I am asking the patient to look down, she is looking down too much. And now capsulorhexis, using a Utrata forceps to do a large rhexis. Size of the rhexis is about 5.5 to 6 millimeter, about 5.75 millimeter. And now hydrodissection is being done very gently. Small amount of PSS is injected at multiple points. The nucleus is tapped, and the nucleus rotates nicely. 2% HPMC is injected again, and now is the time to introduce the tip of the Phaco needle. I made the surface dry and asked my assistant to put few drops of proparacaine. And now the machine being used in this case is Pharos from Otley, Switzerland. The Phaco needle goes bevel down. Some superficial cortical lens matter is removed for better visibility, and so that I can assess the depth of the Phaco needle. Visco again, and now watch submarine chop. The nucleus is pushed a little down and the tip is buried into the substance of the nucleus. It goes through the nucleus towards the opposite equator, and as it reaches near the opposite equator, the nucleus is chopped. Gradually I go to deeper plane. This is also known as multi-level chopping. Rotate the nucleus 180 degree and the two heminuclei are completely separated. One heminucleus has been divided into two pieces. The other heminucleus also divided into two pieces. And now I tilt the nuclear pieces and start emulsifying from the apex. I am using 80% ultrasonic energy in continuous mode. The setting is in continuous mode, but I am applying the energy intermittently. Whenever there is some pieces to be emulsified, at this time there is no ultrasound is being applied. Now at this time ultrasonic energy is being applied, and at this time no energy is applied. So though the setting is in continuous mode, the ultrasonic energy is applied intermittently, and that keeps the phaco needle cool. This is the last piece. At this time I decreased the vacuum to 250. Till now the vacuum was 450 and flow rate was 45 ml per minute. The last piece has been emulsified with 250 vacuum and 25 flow rate. So the nucleus and epinucleus has been managed very nicely, and now cortical cleanup is to be done. I'm going to use a 23 gauge Simcoe cannula for this. We can use anything. We can use bimanual irrigation aspiration, we can use coaxial irrigation aspiration. Whatever we use, we must do a thorough cleaning of the cortex. I'm using the side port to remove the subincisional cortex, and cortical cleanup has been done very satisfactorily. Posterior capsule is clear, no cells sticking to the posterior capsule. Now the capsular bag and antechamber is filled up with 2% SPMC and hydrophobic acrylic single piece monofocal intraocular lens is implanted in the capsular bag. This lens is Superphobe from Appasamy Associates. Superphobe has got yellow tinge, aspheric optics, and it is a beautiful lens. And now the visco is nicely cleaned. The visco from capsular bag as well as from anterior chamber is nicely washed out by the 23 gauge Simcoe. The side ports are closed by corneal stromal hydration. Few drops of moxie is applied in the anterior chamber. A thorough lavage of the anterior chamber is done. The anterior chamber is nicely formed and the case is concluded. Thank you very much for your attention. Hope this video will help you in developing your surgical skills. Be a great surgeon and serve your patients with love, respect, compassion, and great surgical skills.